Good morning, good afternoon, and good evening, everyone, from wherever you're joining us, and welcome to today's virtual demo, an advancement in pressure volume technology. Meet the Millar MPVS Duo. I'm Sarah McFarland from the events team at scientist.com, and I'm very happy to be your host for today's event. Our speaker today is Peter Burlingame, biomedical sales engineer with AD Instruments. Alrighty, and now I'm very pleased to welcome Peter to the floor. Hi, Peter. Thanks so much for being here today, and take it away whenever you're ready.
Awesome. Good morning, everyone. As Sarah mentioned, my name is Peter, and I work here at AD Instruments, and I'm going to talk to you today about the Millar MPVS Duo, an advancement in pressure volume technology. So really quickly, before we get started here, I'm just going to go over the learning objectives and key topics for today. And those are the new features of Millar's MPVS Duo system, how to navigate the Duo's guided user interface, the benefits of Millar's catheter-based pressure volume technology over other cardiovascular tools, how to set up the Duo catheter and accessories, and LabChart's new PV Loop 2.6 module. Before I move on, if anybody's arriving late, I do want to just remind people to answer the polling questions that Sarah just released. And then if you do have any questions, throughout the webinar, please do take the opportunity to put them in the question and answer area on the right side of your screen. So what is the MPVS Duo? The MPVS Duo is Millar's new pressure volume loop system that is paired with Millar's gold standard micro-tip pressure volume catheters. So really high overview. This is a new system that is something you're able to use with both large and small animals, and something that you're able to use with both admittance and conductance technology, all while pairing it with AD Instruments' gold standard Power Lab and LabChart system. So before we touch on all the new features of the MPVS Duo, I just wanted to quickly touch on why we would record PV loops. So PV loops, as we know, allow us to get a full hemodynamic profile. You can measure end diastolic and systolic volumes, calculate stroke volume, ejection fraction, cardiac output, and calculate things like stroke work, tau, dPDT, max, min, contraction time, and relaxation time, all of which we would associate with the term contractility, which I'll touch on in a moment here. And of course, PV loops are generally pretty accessible. There are multiple modalities that you can measure PV loops with. So whether it's PV loop catheters, echo, or MRI, these are all acceptable modalities that people use. If there are multiple modalities, why would you want to use a PV catheter as opposed to echo or MRI? Well, both echo and MRI are largely load-dependent data. Essentially, what this means is during your PV loop recording in either echo or MRI, you're unable to vary loading conditions. Because these methods are also both generally non-invasive, you have to train the animal to either sit for a procedure on a platform and things like that, which takes time to do. It also makes it so that you can only record from the animal for a short period of time. Both echo and MRI also require specialized people to use those machines. So these are a couple of the limitations of echo and MRI as opposed to PV catheters. So the great thing about PV catheters is you'd be able to record load-independent data. So essentially, with a PV catheter, you're able to get all of that load-dependent data for every cardiac cycle, while having the unique advantage of being able to measure hemodynamic changes in response to varying loading conditions, right? So in a PV loop study with a PV catheter, this would be most likely an IVC occlusion. And the reason this is important is because contractility, or The myocardia's intrinsic ability to contract as a muscle is a load-independent parameter. So with the varying loading conditions of a PV catheter and a PV loop study, you're able to calculate end systolic pressure volume relationships and end diastolic pressure volume relationships, which allow you to obtain those other load-independent parameters of contractility. And you're able to do this all while using the PowerLab and LabChart system, a system that gives you 21 beat-to-beat parameters, a software that is tailored to the specific hardware that you're using, as well as a software that provides a step-by-step workflow for you to set up, calibrate, and complete your study. So before I touch on all the great new things about the MPVS Duo, I just wanted to briefly go over some of the limitations that you would see with some of the older pressure volume systems that are out there. So the old pressure volume system from Millar is called the MPVS Ultra. And this system had a few different limitations, the main ones being it required different systems for small and large animals. There is no real-time volume feedback, so it's just a conductance measure until you calibrate it to give you a volume measure. It was only designed for use with conductance catheters. It did not measure phase, and it also required a secondary control software to be run on your computer. Next was the ADV 500. This is a transonic SciSense system. This was an admittance system. It required frequent baseline volume scans during both the study as well as placement of the catheter. There was no on-screen setup or procedural guide. So you have a lot of varying between different users and things like that. And then the volume and phase portions of the catheter experienced lots of signal interference. The next iteration of that system was the ADV 550. It did still have the same signal interference issues that the ADV 500 saw, and it was also not designed to be used with conductance technology. So how does the MPVS Duo combat all of these issues? Well, first, there's real-time position feedback. So when you're placing the catheter, you have feedback from LabChart's XY view, as well as the phase angle of the catheter, which allows you to ensure proper insertion and positioning of the catheter. And it also makes it so that there's more consistency across different users. It makes it so that beginning portion of the study is quicker, and it allows you to kind of, get through more in a day, essentially. There's also real-time volume feedback. So this means that when you're actually seeing data as you're placing the catheter, it has some meaning to you. It actually gives you a volume measurement instead of, something that is relative to the catheter. And it also now conducts an automatic baseline scan. So an often misstep of performing a baseline scan is no longer missed, and you don't have to worry about that variation in, volume measurement from missing a baseline scan. The next big feature is there is an on-screen workflow. So this is designed, with multiple end users in mind, from the most experienced postdoc to, the newest member of your lab, in the sense that, it is user-friendly, intuitive, and it walks you through the entire process of getting set up, calibrated, and recording, making it so that, these processes are standard across, different users, allowing for more consistent data and recordings. Another few big solutions of the MPVS Duo is that it's the same unit for small and large animals. So you no longer have to worry about purchasing a new system if you want to move from rodents to large animals in the future. It's relatively simple in that sense. It also supports both admittance and conductance calibration methods, so you're able to choose whichever method you prefer. Or let's say you even have a collaborator that uses conductance and you use admittance, and you want to see how conductance works or how good the data looks. Now you can actually switch from admittance to conductance and make a decision for yourself, or compare data that way. There's also in-lab firmware updates. So this is automatic updates for the hardware itself that make it so you don't have to send your system in to be serviced, allowing for you to have less downtime in the lab. There is a hydration clock as part of that on-screen setup and guide that we discussed. The reason I mentioned this as a separate point is that it's an often forgotten step. But with this new hydration clock, it makes it so that you basically can't skip it. And you don't have that sampling error in your studies any longer. There's also a virtual workflow module that is an online platform for you to go through the MPVS Duo workflow and setup without ever having to have an animal on the table or a catheter connected. This is great for new members of the lab who maybe don't have experience handling catheters or anything like that. You want to give them an idea for what they're going to go through before they actually get those things in their hand. So that's why the virtual tool was created. And then the other big thing is that it's one software set up for recording and calibration, eliminating that secondary software that needed to be used previously. And of course, you get to use these new features with the PowerLab and LabChart system. The LabChart system will give you those 21 beat-to-beat parameters automatically, calculate end systolic pressure volume relationships and diastolic pressure volume relationships. It'll also provide you a simple workflow to guide you through calibration and data collection for both admittance and conductance models. There are also several fit options for end diastolic and end systolic pressure volume relationships, as well as separate settings for both right ventricle and left ventricle studies. So now I'm just going to quickly introduce the video that we've recorded for this webinar of the MPVS Duo hardware and LabChart setup. So in this video, you will get to see a nice sneak preview of the new PV Loop 2.6 module and LabChart, which has an updated workflow and takes away that secondary control software that we discussed. You'll also get to see the on-screen workflow of the MPVS Duo itself, and then you'll also get to see how all of the hardware is connected and set up. So without further ado, I'm going to go ahead and play the video.
Hi, I'm Mark, and I'll be demonstrating how to set up the MPVS Duo and LabChart for PV recordings in small and large animals using the admittance method. Make sure you have installed LabChart and the PV Loop 2.6 module. Connect the C-Series PowerLab and instrument interface to the PC. How to do this is shown in another video on the ADI website. For recording using admittance mode, I will connect pressure for ventricular pressure, volume for the calculated volume using the admittance technique, phase for showing the phase signal, which is used in catheter positioning, and lastly magnitude for displaying the measured admittance from the ventricle. This channel is synonymous with the total conductance measured from the heart. Connect the micro HDMI connector to the catheter input and connect the other side to the catheter. Don't forget to soak the catheter for at least half an hour. Plug the included power supply into both a wall outlet and the MPVS Duo. The system is now ready to record PV data. Switch on the MPVS Duo by pressing the On button on the MPVS Duo keypad. Start lab chart. Close the Welcome Center. Click on Setup and Channel Settings. Reduce the number of channels to 4 and name Channel 1 Pressure, Channel 2 Volume, Channel 3 Phase, and finally Channel 4 Magnitude. Click on OK. Once the MPVS Duo has initialized and with the catheter connected, press 1 to start a new PV loop protocol, and then again on 1 to select admittance. You will now be prompted to soak the catheter for 30 minutes. If the catheter has already been soaking for 30 minutes, you can press forward arrow to go to the calibration screen. In LabChart, select the PV loop menu and select Workflow. If this is grayed out, check that the Enable PV Loop Workflow item is checked under the Workflow Mode menu item in the PV Loop menu. This will open the workflow window on the left. First select the workflow. In this case, it's MPVS Duo admittance. Next, select the channels in the lab chart designated for pressure, volume, phase, and magnitude. These should correspond to the channels connected to the MPVS Duo unit. Once all selected, a green check mark will appear next to the Setup PV Loop item in the workflow. Now go to the next item in the workflow list, namely Duo Channel Calibration. Select the type of catheter you'll be using. The list allows for rat, mouse, a series of ventricath, and manual. Manual is used if you want to enter values from scratch. In this example, I'll use the rat catheter. It is suggested to use actual voltage values from the MPVS Duo, as there could be variation between systems. To do this, start lab chart. Then on the Duo, press 1 to go to the low voltages screen. Next, press 0 to output this to lab chart. Record for a couple of seconds and then press the left arrow on the Duo to go back to the calibration screen. Next, press 2 to go to the high voltages screen. Again, press 0 to output this to lab chart. Then the left arrow again to go back to the calibration screen. Stop the recording in lab chart. Now for the pressure channel, select the region of lab chart just before and then just after where you can see the data jumped when the high calibration data was recorded. Add these to the pressure calibration boxes, one for 0 mm of mercury and one for 100 mm of mercury, as demonstrated here. Repeat this for the remaining 3 channels. Do not forget to check the Apply Calibration checkbox for each. All 4 channels are now calibrated. On the Duo, press the forward arrow to move to the Balance Pressure screen. Next, press on 1 to balance the pressure sensor in the PV catheter. Press 1 to zero the pressure. The current reading on the Duo should drop to 0, as it does in lab chart. Stop lab chart. Now press the back arrow on the Duo to go back to the balanced pressure sensor screen. Next, press the forward arrow to move to the calibration parameter screen. Enter the values for muscle, stroke volume, and blood resistivity. These values can be found in the literature and through actual measurements. Please see the manual for more details. Next, in lab chart, move to the sampling section of the workflow. Click on Start Sampling. On the Duo, press the forward arrow to move to the Optimize Catheter Position screen. Introduce the catheter into the ventricle. For small animal catheters, only one segment selection is available. For large animal catheters, make sure you select the segment with the size suitable for the animal's ventricle. To do this, press 1, and then the segment number and OK to select. Please see the manual for more information on the segments. A low-pass filter can also be switched on in this screen by pressing 5. Once the catheter position is optimal, with phase and magnitude being within the specified range as shown in the manual, the forward arrow button on the Duo can be pressed to move into experimental mode. Once in experimental mode, the experiment protocol can be followed to record baseline and occlusion data to calculate load-independent parameters such as ESPVR and EDPVR. Once the experiment has been completed, stop recording and check the box for sampling complete in the sampling section of the PV workflow. Now the data is ready to be analyzed using the analysis section. You can now analyze your baseline and occlusion data.
All right.
Awesome video. Thanks so much, Peter. Really great presentation. I hope everyone found that super informative. Okay, Peter, if you're ready, I'm going to start the Q&A.
Perfect.
All right, so the first question here is, what do you mean that the ADV 500 and the ADV 550 had signal interference with phase and volume? Can you specify or give details on this?
Yeah, so there was a high frequency noise issue that they would see with the ADV 500 and 550, which is why there is a low pass filter option on the MPVS Duo, as you saw in like the last minute of that video. Where the actual noise comes from, I don't know, but I do know that it was a high frequency noise, that they combated with just a hardware low pass filter.
Okay. Awesome. Thank you. Hopefully that answered your question. Next question here. Is a volume calibration performed outside of the animal?
So that's up to you. So if you use an admittance mode, no. If you use conductance mode, yes.
Okay. Perfect. Another question here. What does clicking the sampling complete button actually do? Does it interfere with any of the recorded data / the following analysis?
So I'm guessing that you're referring to the sampling complete button that's on the MPVS Duo. Yeah, so this essentially just will stop the recording. So it won't actually change any of the recorded data, and it won't change how you perform your analysis, so to speak. It just pretty much ends the recording.
Okay, good to know. All right, next question here. Can I use my old SciSense catheters with the Duo? And what about the MPVS Ultra catheters from Millar?
Yes, so you would be able to use the old SciSense catheters with the Duo. With the new Duo system being released, there also are catheters that are compatible with the old 550s and 500 systems. You would not be able to use MPVS Ultra catheters with MPVS Duo, however.
Okay, good to know. Another question here. What if I want to record from the right and left ventricle simultaneously? Is this possible?
Yes. So previously, you would have had to have two computers and 2 instances of lab chart running in order to record simultaneously from the right and left ventricle. However, now you would just need 2 Duo systems. So you'd be able to connect 2 Duo systems to 1 instance of lab chart and be able to record right ventricle and left ventricle PV loops into the same software at the same time.
Okay. And someone else has asked, can I use my existing power lab with the Duo?
Yes, you can.
Okay.
So the outputs from the Duo are simple BNC connections that you'd be able to use with most power lab models, actually all power lab models.
Okay, as long as you have 2 channels. Okay.
Yeah, exactly.
Good stuff. And earlier you mentioned that you could connect 2 Duo systems with one lab chart. Did you mean connect them with one power lab?
Yes, that's what I meant.
Okay.
You'd still be able to record into the same lab chart instance as well, right? So you have your left ventricle and your right ventricle.
Okay, perfect. Just as a reminder, if you do have questions for Peter, please use that Q&A tab to submit them now.
I would also like to mention quickly, you see this screen with additional resources and support, and it has lots of helpful links. You can find an actual handout for this in the Handouts tab on the right, which will have links that you can click and navigate to.
Perfect. Yes. And all of these resources will be available until the end of the demo today. But of course, if you didn't access them now and you want them, you can reach out to Peter. His email is on the screen there as well. We have some people asking about price point. I'm going to let those questions just slide because I think that you probably need to discuss your application with the sales team for those.
I would concur with you.
Yeah. Someone else has asked, do you provide surgical support?
So we do have some helpful videos on our website that go over, surgical insertion of catheters. And you can purchase on-site surgical training for an additional fee as well.
Okay.
And those are really the forms of surgical support that we provide.
Yeah, that makes sense. Yeah. Learning how to place those catheters is pretty important.
Yes.
Somebody else here has asked about pressure calibration. What is the pressure for calibration, and does it need to be 0 exactly?
I guess so. The pressure for calibration. So the calibration values for the pressure are included in this MPVS quick start guide, but it's an electronic calibration. So you're, sending out a voltage associated with a specific pressure from, the MPVS Duo that we saw, in the very beginning when I was doing that 2-point calibration. So that's where the calibration values come from. I'm not sure if that really answers the question, but it is an electronic calibration. You're just performing from the Duo itself.
Okay, thanks. There's a question here about large animal PV loop workflows. I'm going to direct that person to reach out to you directly, Peter, if that's okay.
Yeah, that's fine.
Yeah, so email Peter if you would like to learn a little bit more about the large animal stuff. And there's another question here about volume calibration again. How is the volume calibration with a conductance catheter different than with the admittance catheter?
Yeah, so a conductance catheter requires you to perform a cuvette calibration as well as a parallel conductance calibration. And these, the parallel conductance requires a saline bolus, and the cuvette calibration requires sacrificing the animal and actually filling cuvettes with blood. As for the volume calibration of the admittance method, these values, come from the literature essentially, and are available in the MPVS Duo Quick Start Guide.
Okay, awesome. Yeah, so you can download that in the Handouts tab to learn a little bit more about those calibrations. Another question here. Do you have admittance catheters for large animals?
Yes.
Okay, perfect. Good answer. Right. A reminder, if you still have questions for Peter, please use that Q&A tab to submit them now. Just waiting for any more questions to roll in. You've answered most of them already. And if there's no more questions, we can probably close out here. I'll just give everyone just a few more minutes. If they do have a question, they can type that in.
Yeah. And if you feel like you may not have enough time to ask your question now, feel free to just take a picture of my contact information, give me a call, send me an email, and I'll get to your question.
Perfect. There's a question here. Is the data comparable with admittance and conductance catheters?
Like, can you compare the data between the two using the system, or?
I'm not quite sure. We can ask for a clarification there. Yeah. Give them a few moments to type that out.
I would imagine the answer to that is yes, but I just want to get a clarifying.
No clarification has popped in yet. Oh, there it is. If I switch catheters to admittance catheters. Okay, so yeah, like they're using conductance now, but if they switch to admittance, what happens to their data?
Yeah, that's a good question. I mean, you may or may not be able to see changes in your data. I guess it really kind of depends on what your animal model is, what your treatment is, if there are any disease conditions in the heart. But you would be able to switch from conductance to admittance, if you are using an MPVS Duo. So you could record in conductance mode and then admittance mode and kind of determine whether or not you think the data is comparable and whether or not that's something you want to switch to.
Gotcha.
So a few things I've been told, I guess, is it kind of depends on whether or not you're able to independently, measure stroke volume. I was told once before that if you're able to independently measure stroke volume throughout, an entire study, your admittance values and conductance values will look relatively the same.
Okay.
Now, if you're unable to do that, I think it's still a matter of personal preference.
And if you're able to record both, it might make sense to record both for a little while until you can ensure that your data is comparable across the different methods.
Yeah, that's certainly something you could do.
Okay, awesome. I don't see any new questions coming in. Another one about surgical support, but again, you've answered that. Like I said, if you do have questions for Peter, submit them now. When I end the demo, there will be a survey that pops up. So if you think of something afterwards, you can always type it in there. But as Peter mentioned, of course, you can also email him directly, and his contact info is on the screen. So I think we're probably good to go here. Peter, I want to thank you so much for your time and your expertise today. It really was a pleasure to have you with us, and I hope that you had fun.
Yeah, I appreciate everyone's time, and thank you for attending our webinar. Great.
And I also want to thank the live audience as well. We know you have busy schedules, so we're happy to have you here live. A survey will appear, like I mentioned, at the end of the demo. So we'd love to get your feedback there. And in closing, we hope that you enjoyed this Inside Scientific virtual demo produced in partnership with 80 Instruments, and I hope that you enjoy the rest of your day.